Welcome back to Living Local. Joining us today, we have Lori Miller. She's an independent insurance agent. Thanks for being here. Beautiful day, huh?
Thank you for having me.
Okay, so let's start off with this. Talk about your background when it comes to selling insurance.
Okay. Well, I specialize in what they call the senior market. So my primary focus is helping people with their Medicare options. Whether they're new to Medicare or have been on it a while. Medicare is just a very complex, confusing process. And a lot of times people even have been on Medicare for a while, but they don't know whether they've made the best decision for themselves. Or they're at a place with their current coverage where they're challenged by their premiums being too high, or maybe they're unhappy with co-pays and co-insurance, and they just want to know what options they have. So I come from a place of education and sit down with people at no cost to them, take a look at their coverage options, at their health needs, at their financial constraints, and try to make sure that they're getting the most out of their Medicare at the least amount out of their pocket.
Okay, Lori, talk about where your focus areas. You talked about, the elder market, but you have other areas as well, right?
I do. I do life insurance for all ages, so it doesn't matter whether they're children or 80 years old. And there's many different types of life insurance, and so it's something that you need to buy or consider very carefully and make sure that it is going to meet your needs. If you buy the wrong type of life insurance, it may never benefit you or your family, regardless of how much you've spent on it over time. And being independent, that gives me the ability to represent many companies. And so I'm always working for the client, and we try to find what is going to be the best fit for their particular needs. And if that means I need to go out and research a different type of company or a specific policy and contract with them so that I can procure that coverage for that person, then that's what I do.
And I mean, let's be honest, the healthcare system is constantly evolving. So you're having to educate yourself, on all the ins and outs, so then you can translate that to the client, right?
Absolutely. And I go through a lot of continual training and recertifications every year for virtually every Medicare carrier that I represent, as well as national certification. So when my daughter was in college, she used to joke that, Mom, you take more classes than I do. And that's so that we can really stay abreast of all the changes, and that I have the expertise to advise people.
And you have such a great demeanor, and I know that healthcare and health insurance and insurance in general can be really stressful. So how do you kind of walk people through that process?
Well, I like to sit down with people, and I also consult with people remotely by phone. That's fine. I have a lot of clients who aren't even local. But I like to start, before we ever get to insurance, I like to start with their health, how they're currently using the medical services, and what their medical needs may or may not be, their budgetary constraints, because that also helps me determine if they may qualify for any state or federal subsidies. And if they do, then I help them apply for those subsidies because they're very important. If they have a particular need with a particular medication and it's problematic because they just simply can't afford it, I cannot promise them that I can find a resource for them, but I will turn over every rock looking for those resources. And I really pride myself in all of those things. And then when it comes down to selecting an insurance product, because I have the whole array, we can really tailor it to them. Is their doctor in network? Are all the medications they take on the formulary? Does the price fit their budget? Is it the type of coverage that they want? Because Medicare supplements work very differently than Medicare Advantage plans. And they function very differently, and those are big decisions to make. So it's not uncommon for me to spend 90 minutes or 2 hours with somebody, especially if they're new to Medicare, because there's a lot of thoughtfulness in the process, and nobody should make a rash decision based upon a TV commercial for a particular carrier, or the onslaught of mail that they received, or because their neighbor likes a particular plan.
Or because they're just frustrated and they just want to get it over with,
and
right?
And that happens a lot, that people say, I just gave up, I was overwhelmed, so I just picked one and I called an 800 number and I enrolled in a plan.
And you do it's not a one size fits all, you know, you've really got to take an approach looking at it case by case.
Case by case, to the point that oftentimes married couples have different needs in their coverage. They may one may need a supplement, one may be on an Advantage plan, they may be with two entirely different companies. And so it really truly is the definition of one size does not fit all.
Alrighty, well, is there anything else we need to know before we go?
I would love to help anybody who's either coming up into Medicare or already on Medicare, and you just have a question. It may not even require a full consultation. They can just give me a call. Oftentimes it's a quick question I can answer for them right over the phone and just put their mind at ease. There's never a charge to consult with me, and there's never any pressure to enroll in any particular coverage. That's what I'm there for, is to help you find your own path.
Awesome. Well, thanks again for being here
And
with us.
thank you so much for having me. I really appreciate it.
And for more information, of course, you can head online to agentlaurimiller.com.